Hi, I'm Dr. Sanan, and today I want to clear up a question that a lot of my patients have. What's the difference between a regular facelift and a deep plane facelift? So let's start talking about the traditional facelift. Terms that you may see or hear about include a subcutaneous lift or a SMAS facelift. A subcutaneous facelift is just another word for a skin-only facelift. That's the most traditional way of doing a facelift. Your skin of your face is lifted up and it's pulled back as tight as possible. A SMAS facelift is similar to a subcutaneous facelift where the skin is lifted and then the SMAS layer, which stands for the subcutaneous musculoaponeurotic system, which is this kind of fascial layer that covers the facial muscles, has some stitches put in it, and the surgeon tries to lift your face by just doing some stitch work. The problem here, in my opinion, is that too much tension is put on the skin, so people end up looking really stretched and over pulled. And that gives the bad rap to facelifts about the corners of their mouth being pulled in the wrong direction or their skin being too kind of pulled back and having a fake appearance to it. Traditional facelifts have been a thing of the past in my opinion. Any modern day facelift surgeon who has a high volume facelift practice is going to be not doing these techniques and will prefer to be doing a deep plane facelift technique. Also, in my experience, just seeing patients who've had a traditional or older school facelift, the scarring can tend to be worse. And the reason why this is when you lift the skin layer and you really crank on the face and pull it back, that puts a lot of tension on the skin. And tension in any area of the body results in poor wounds and poor scarring. So that means that the scar in front of your ear and behind your ear, it might be wide, it might be thick, and it's very noticeable. And that is a big concern for my patients because they want to have as discreet a scar as possible. Another thing about traditional facelifts is while it might be helpful for someone who has really early signs of aging, the reality is that you're not addressing the root cause of aging. Therefore, traditional facelifts just don't last as long as a deep plane facelift. We see patients coming back in who may have had surgery elsewhere. They say a year or two ago, I had a facelift. Within a couple months, I felt like my face fell back down again. And that is a common thing that we kind of expect to hear from traditional facelifts because the muscle layer is not being lifted, which it is in a deep plane operation. So the short of it is the traditional facelift, which is commonly known as a subcutaneous facelift or a SMAS facelift, really focuses on lifting the skin and pulling it back as tight as possible. But this end results in poor scarring and people looking overpulled, overstretched, which is exactly what they don't want to look like after a facelift. Now let's talk about deep plane facelifts and neck lifts. We're taking things literally a layer deeper. So you have the skin layer, then you have the SMAS layer. Underneath the SMAS layer is what's called the deep plane. In this layer, there are ligaments that pull the face and the neck down. You have to sharply cut and release these ligaments to have full control over the facial muscle layer of the patient. When you cut these ligaments, you're able to lift the SMAS layer and the neck muscle layer vertically, which is the direction that we need to restore your face and neck in order to give you the most youthful appearance. When you do this technique, it requires a lot of technical precision, and that's why I think many plastic surgeons don't feel comfortable doing the surgery. You're not doing any tension on the skin. All the tension is putting on the deeper layers, which is the root cause of your aging. So if you look at anybody who does deep plane surgery and look at their before and afters, you'll notice that the patient's cheeks, that their jaw lines and their neck lines are as crisp and as tight as possible, but they don't look over pulled. If anything, they look refreshed. And that is the key word that my patients are looking for. They want to look like a plastic surgery result without looking like they had plastic surgery. My patients get compliments that they look like they've been on vacation, that they've been eating and sleeping better, or maybe they changed their hairstyle. No one's like, hey, you had a facelift or a neck lift. But when you look at their side by sides, the results are jaw dropping. Their jaw lines are crisp, their neck lines are as tight as possible, their cheeks volume is restored because the cheek fat pad has been lifted, and also most importantly, their scars are minimal to undetectable. Good plastic surgery exploits natural curves and creases in your face and your neck. So for a deep plane facelift, the incision goes along the edge of your sideburn, increases in front of your ear, behind your ear, and then a small incision and a natural crease in your chin. Over the upcoming weeks after your surgery, the scars fade to a fine white line, and people don't even realize, and they forget that they had surgery because the scar is so minimal. So then the question comes from patients, why don't all facelift surgeons do deep plane surgery? And I think the crux of this is that many surgeons don't feel comfortable in the deep plane. The deep plane is an area full of facial muscles, facial nerve, and important blood vessels. So there's a lot of high real estate in the deep plane of your face and the deep plane of your neck. Through my years of extensive experience in my residency training as an ENT head and neck surgeon, and then doing a fellowship in facial plastic surgery, I have the skill set and the experience in order to understand and really master the anatomy of the face and neck. My entire practice is devoted to just facial plastic surgery. So that just means that I'm not doing any breast work or any body work. I'm focused solely on the face and neck, and that allows me to really become an expert in this area. I think that deep plane surgery is the gold standard, and it's going to soon be known as the way of doing facelifts. So instead of saying that I do a deep plane facelift, I just say I do a facelift and my technique is deep plane surgery. You look at the results, looking at the cheeks, the jawline, the neckline, looking at the scars, patients look fantastic. They look 10+ years younger, they look refreshed, they look more youthful, and they're super, super happy. So in summary, I want you to take away from this video the different types of facelifts. A traditional facelift may be something that's called a subcutaneous lift or a SMAS lift, and then deep plane face and neck lift, you understand the differences in the anatomy and the layers of the face and neck that you're lifting. There's a lot of information out there if you Google search facelift surgery. So my job is to educate you, to inform you that if there are concerns that you have about your appearance, and they focus more on your jowls, your lack of jawline definition, your loss of neckline definition, maybe sagging cheeks, that you understand why I recommend deep plane technique and why I think that deep plane outcomes are much more natural, much more refreshing, and they last longer compared to traditional outcomes. If you're interested in seeing me for a consultation, please visit my website at www.drsanan.com or call the office, and I'd be love to see you for a consultation. If you enjoyed this video, please like and subscribe to my channel and follow along for more facial plastic surgery educational content.